Hello, my name is LaWanda Hopefields, and I have the honor and the privilege of serving as the director for the Ronald E. McNair Post-Baccalaureate Achievement Program, also known as McNair Scholars. During this 2019-20 academic year, we are excited to celebrate our anniversary of 25 years on the Wichita State campus. Although during this year, we have encountered many challenges, as most of America has, we are so proud to still celebrate our students, and we have great appreciation for the faculty members who have stayed the course to bring this year's scholarly activities to a close. I would like to acknowledge my boss and mentor, Ms. Delta Q. Colvin, for her support during these most recent challenging times, but also for her confidence in me to lead this dynamic group of students. Miss Ashley Cervantes and Miss Nisha Green are the capable hands behind the scene, and a mere thank you is not enough for all that they do. They are the backbone of our program, and I am forever grateful. As we celebrate 25 years of academic excellence and 15 students who are completing their scholarly research, I also want to thank you as our supporters and as our listeners. Thank you for being there for the students and for the program as we celebrate 25 years of academic excellence. Enjoy these dynamic presentations.
Good morning. My name is Ya-Aida Sillah. My research mentor is Dr. Nikki Keene, and our research study is over understanding knowledge of fall prevention in care homes. One of the greatest threats to the well-being and independence of an older adult patient is experiencing a fall. Due to this, the significance of fall prevention strategies is being able to keep in mind when providing care for an older adult patient. Preventing falls and injuries should be remained as a high priority. Acknowledging the effectiveness of fall prevention is crucial due to enhancing and maintaining the quality of life for residents among a nursing home community. When acknowledging the degree of efficiency in fall prevention, we look at a couple of distinctive attributes, such as risk factors, fall risk assessment tools, as well as educational programs. These findings can potentially demonstrate the adequate knowledge direct care providers and administrative associates have in doing so to prevent and also utilize potential strategic interventions which need to be conducted to help spread fall prevention awareness. Prevention measures is a crucial part of this study as well, which includes universal design, targeted intervention, and physical activity. Universal design consists of looking at environmental as well as products in a nursing home facility and or any other community which helps enhance the benefits for all individuals while going unnoticed on certain occasions. Physical activity includes creating wellness services to help enhance the quality of life for the resident, as well as looking at lifestyle modifications. And targeted intervention represents a form of prevention, which processes the residents' needs as well as notates their day-to-day activities, which shifts into a focused action plan to help address and notate the residents' needs. Overall, if healthcare facilities utilize fall prevention strategies such as universal design, physical activity, and targeted intervention with the resident, then a fall is less likely to happen. Going over the research question for this study, we propose: do members in the healthcare facility think they are receiving adequate training in regards to fall prevention? Over the course of the study, 25 participants were taken into account. The participant eligibility include individuals must be 18 years or older, as well as a staff member or a part of an administrative team in a nursing home community. The questionnaire items for this study consist of 6 demographic questions, 6 multiple choice questions, and 2 unanimous questions. Also, this survey was conducted during the spring semester of 2020. Our research study received IRB approval from Wichita State University before the survey was dispensed. Also, all participants were notified and informed that all information and personal data conducted into the survey would remain anonymous as well as confidential. The construction of this survey focused on identifying improvements in local nursing home communities to use a more patient-centered approach when identifying, protecting, promoting, as well as maintaining the strategic interventions that are implemented for the safety of residents. After 25 participants were surveyed, the majority of participants in the study demonstrated adequate knowledge in different concepts utilized in current fall prevention strategies, such as universal design, physical activity, and targeted intervention. Originally, this study was reflected upon many Wichita nursing homes currently carrying out standardized assessments when a fall occurs, such as individualized care plans. However, individualized care plans consist of structured care that meets the residents' needs on their day-to-day basis, which is also known as a residence care plan. Majority of participants selected the option where residents would need different care based off creating an admirable patient-centered care plan. These results represent why a vast majority of local Wichita nursing home communities taken into account the standardized goal of practices to prevent any additional harm to the residents. Based on the responses from the previous question, looking upon this question consists of majority of participants choosing the possibility of allowing employee-led meetings. These meetings would entail administrative associates to listen to employees' suggestions and their strategic fall prevention strategies that they would try to implement in their community. This particular methodology would reflect upon community-based organizations. The results represent why a vast majority of participants would prefer employee-led meetings so that each and every voice can be heard in regards to implementing fall prevention strategies for their particular community. Strengths all Wichita nursing homes had were informing all members of the community educational aspects within fall prevention. This quote reflects upon Kimmett's personal statement of by having the right knowledge and skills can help improve care, and in doing so, the health, well-being, and quality of life for residents. The limitations in the study include the sample size as well as time. Originally, this study would include an additional educational aspect as well as resources. However, due to COVID-19, we were not able to do this. Due to the small sample size, these results may not be generalizable. The fall prevention study could also have improvements by taking into consideration administrators, associates, as well as direct care providers separately. By this, we would conduct a survey whereas administrative associates would be addressed upon their policy regulations and leadership skills that they provide within their community, and for particular direct care providers. However, direct care providers will be assessed upon the knowledge as well as the effectiveness of the policies provided by their administrators. One educational aspect that could be included for future research is for fall prevention includes identifying the finest pre-intervention strategy for all senior care communities. This would help include maintaining efficient fall prevention by utilizing a universal design for the baseline of care for all residents in a particular nursing home setting. In conclusion, although every fall and injury cannot be avoided, this survey encouraged dialogue among administrative associates and direct care providers. By maintaining efficient communication, we'll conduct proper targeted intervention for each and every resident to help maintain strength and independence, leading to a reduction in falls in their particular nursing home community. Thank you, and I'm open to questions. When I looked upon the results from the questionnaire, I did see a difference in based off like the job duties. Like for example, CNAs would entail their activities of daily living, and administrative associates will entail the policy regulations. So me and my research advisor would conduct, and basically we just looked at how both of them how they both reflect upon each other. In terms of looking at the utilization of fall prevention, we would just suggest that each facility looked at the universal design concept, whereas looking at the baseline of care for each and every resident in pertains of to their particular nursing home facility. I would expect them to be different by the responses from their position, whereas the direct care providers are in contact with residents as well as family members on a day-to-day basis. However, administrative associates are in the back end, whereas they would look upon how effective or what they can do differently to help direct care providers like on their day-to-day basis in regards to strategic interventions for the residents. This concludes my presentation for understanding knowledge of fall prevention in care homes. Thank you for listening.